long meeting, so I'll apologize in advance for that. Since we didn't have one last month, we have a lot of new things to go over after Kipp. So we're gonna let Kipp start. I'm sorry I was wrong on my, Pace is gonna come at 5:30 to talk to us. I'm just dyslexic today. So we'll start with Kipp. And Kipp will be with us this time, and then he'll come one more time in March. We'll go over some mental health topics, so we'll let Kipp start. Thank you for coming again.
So it feels like it's been a long day for some reason. Are some of you just starting your day? Are you coming in for a shift, or how's that go?
Some of both.
Some of both? And are some of you haven't been working today, but you're just coming in for the weekend?
Correct.
Okay, that's rewarding, right? Okay. Well, when I met with these two a few months ago, we sort of discussed a few types of topics we talked about, and of course I never talked about anything that I don't know something about, so I helped to channel it towards something that might be something I can talk about. So today we're going to talk about basically the idea is dealing with difficult people. Sometimes we have difficult clients come in, I guess you call them here patients, could be coworkers, and this topic could generalize to even a broader level. You know, you could be how to deal with people at your home, because I'm sure all of us have difficult people at home. Sometimes we are the difficult people at home. So I'm going to talk about conflict management and give you a bit of a framework, a little model to think about. Now, did everybody already get a handout? Okay. And so as I talk about this, you know, each last month I made a presentation to the Lincoln County Leadership Institute, and in their presentation, what I did, I took all day long to make the presentation, and basically what I did is I looked at 9 different personality types and how two different personality types may see things completely different and have conflict just because the way you see the world. Today, we're not taking that kind of time to lay that out and get into those kind of dynamics. I'm going to talk about conflict management more in a general kind of a framework. But sometimes our differences with other people are more personality driven and not just an issue kind of a thing, you know, by itself. And as I talk about things today, the strategies or the styles of managing conflict that I'm going to talk about aren't about your personality type. They're about the way you tend to respond to conflicts. So try not to get mixed up with what I'm going to lay out as like, well, that's just the way you are. When you have a personality type, that is just the way you are, and we're not going to ever change the spots on the leopard. Leopards are always going to have spots. It's just how they are. And if you're a certain type, you can modify it occasionally, but you're never going to really change it. And how you manage conflicts, though, are different. You can change your style, and you can learn skills to manage conflicts in a different way. So I'm hoping that this relates to that topic well. The other thing, like today I sat down with a married couple, and they were talking about issues that they were having with one of their kids. And you know, as I get into that particular situation, the conflict's going on, and we're talking, you know, we're not talking about here's your cookie cruncher method of managing conflict. Let me tell you how you're acting and how you need to change. We get into more specific details about specific situations. It tends to set people off, and those are different. So it may be that you have a spouse or a partner or a child or a coworker, and around that particular relationship or in that particular situation, you may act a lot differently than you do in another particular situation with other people. And so I guess what I'm saying is there's not a one shoe fits all for every situation that you're in a conflict. And if you, for some reason, need to get into something more specific, that'd be about your specific story. Now, I like talking about people's specific stories, so if somebody wants to share anything about a conflict that they're having with somebody or have had with somebody and what the situation is like. And we can talk about that, but that's not my purpose today to bring that out of you. So, but if you do share, don't talk about anything you wouldn't feel comfortable talking about or having that other person hear about in another situation. So, sound good? Okay. So, so you got your next person. I know you got your pharmacist in at 5:30. Am I supposed to take till 5:30, or you got other things to fill in?
We can fill in.
Whatever
That's
you
fine.
need.
Yep, whatever.
Okay. Well, like I said, I could take all day if we wanted to. So I'll hold it to that. Okay. So when we're looking at conflicts, the first page that I've got there, and if you brought a pencil, this could be a good exercise just to go through and answer those questions. I didn't anticipate that we would, but actually it would be interesting if you have a pencil or a pen, you could answer those questions. These are basically proverbs on sort of your typical strategy or belief about conflicts. And do you want to take the time to go through that, or just use that as something you want to do later? What's the general consensus here?
Let's do it.
Do it now? Do it now, do it later?
Both.
I'm good.
Okay, well, go ahead and, let's just go ahead and look through those. And so this would be your typical strategy. So on this 1 through 28, you're rating, this is very typical of me, frequently, sometimes, seldom, or never typical. And then again, these are like proverbs. So how about, yeah, just go ahead and read them yourself and just mark, how likely is it that you will use that type of a strategy? And then if anybody has a question on what one of those might
Come on,
mean.
Dave, do it. I want to know if you're a teddy bear or a tiger. Oh, you are. No, you can't. But you gotta put them down here to know what you want.
Uh-oh, Dave's gonna have a conflict already. I see that coming.
We always conflict. It's good.
We usually laugh as we do it.
And as you mark these things, some of them you may agree with more than others, but that's not really the question. The question is really how do you act in a situation when your will and somebody else's will are against each other in some way, disagreeing. Okay, everybody have a chance, and everybody still need to add theirs up. Okay, well, you keep adding and stuff, and I'll go ahead and start into this presentation on the board. So when we're dealing with another person, we don't really think of it this way all the time, but if you think of it this way, we've always got two concerns primarily. We've got how important is the relationship to me, and the relationship can be highly important to me, or it can be very low importance to me, and how important are my personal goals. I could really not care about my personal goals in this situation, or I could care a lot about my personal goals in this situation. And these two concerns drive how you are going to act in a conflict. And another concern that we'll throw on here later, another one would be how important is your own self-respect. Because sometimes we act in ways in a conflict situation that doesn't jive very well with our own self-respect. We demean ourselves by the way we reacted in a situation, and then later we then beat ourselves up over looking back on how we made a fool out of ourselves by acting that way. But as we look at how important the relationship is and our personal goals, we can take these two concerns and break them down in these four quadrants. And this one right here says, in this situation, the relationship matters the most to me, and my own personal goals don't matter too much to me. What I want isn't that important, what you want is more important to me. And this person acts like a teddy bear. Teddy bear, soft, easygoing, passive, willing to give you what you want. Doesn't want to rock the boat, doesn't want to cause any problems, wants to go along, to get along, and keep everything as smooth as possible. And so a teddy bear, we could say, is passive. They're nice, giving, and smooth, would be another word. And that's their strategy. Now, you could, well, we'll get into some of these particulars here as we go. So that's the teddy bear. The opposite of a teddy bear says, I don't really care about you. I don't care about our relationship. All that I care about are my goals, what I want, what my needs are. And this person, when they're acting this way, acting like a shark. And the shark, instead of being passive, the shark is aggressive. And can be attacking. Not very nice, unless they're getting their way. And but basically they're quite forceful. They're definitely verbally attacking, and if you're not careful with the shark, he could be physically attacked. And over here in this corner, we have somebody who's basically saying, I don't care about the relationship, I don't care about my goals, I don't care about anything. And this person, when they're acting like that, they're acting like a turtle. And they are passive-aggressive. One thing there with drawing, and one way we can, you can see a turtle, is a turtle does not want to make eye contact with you, does not want to engage, doesn't want to talk about their needs, doesn't want to hear your needs, wants to pull down, shut down, withdraw from the situation. Where this one is more in your face. They'll tell you what you want, they'll tell you what you need, they'll tell you what your problems are. Now the turtle, I call this more like a snapping turtle, because they can be passive, but then they can come out in ways that look very aggressive, but really it's a passive-aggressive approach. Their typical nature is not to be aggressive, their typical nature is to be passive, but then they take so much and they come snapping out with some kind of statements or behaviors that can look like this sometimes, and but not so much. And then this person up here, this strategy, says that the relationship matters a lot to me, and my personal goals or objectives mean a lot to me. And this one is an owl. And the owl is assertive. And the owl confronts. And basically leans forward into this, doesn't avoid a conflict. This is not looking for a fight, but wants to stick in there and deal with this thing and try to resolve it, figuring out that if we'll talk about this, if we'll get it out, then we'll be able to take care of it and make it the best situation we can. And so, at any time, with if on a general day you were getting tested, if there were a way to really test this, you would probably, most of us would probably test out somewhere in that area. And then something happens that you don't like, you're dealing with a person that you feel like is taking advantage of you or whatever's happening, and then you'll change from this particular position to another position. You go up here and become a teddy bear, or you'll travel down here and become a turtle, or you'll come over here and become a shark, And you'll move out of everything's great, everybody's wonderful, we all count our goals, relationships are important, and now you've changed your present interpersonal position to another position because that's your strategy for dealing with conflicts and differences. And once you're in one of these boxes, then you might travel to another place until you can finally get yourself back centered again and get yourself back up here where you're trying to work out, I'm okay, you're okay, we're going to work on this together. If we got into these extreme corners, somebody down here extremely disinterested in their own goals and their own objectives, extremely disinterested in other people, what their needs are, what the relationship is. What do we think of a person? What's the risk of a person who's
Sociopath.
so shut down that they don't care about anything anymore?
Depressed.
Depression and a major suicidal risk. Somebody who just doesn't care about anybody right now, doesn't care about themselves. And this kind of person over here, Trish was on one, that sociopath, so interested in their own needs, so interested in their own goals that they don't care at all about the relationship, but they're extremely self-centered at that moment. Could, may kill self, may kill other, may attack other, may hurt other over here because they are so self-absorbed. Now this one up here, you could call a, this is the kind of person that when they die, everybody else's life flashes before their eyes because they didn't have a life. They lived their life for everybody else, they give in to everybody else, they were just passive and easy to get along with, and nobody had any conflicts with them because they gave their whole life to everybody else. And sometimes this kind of person you could call, in a clinical way, you could call them a codependent. They're living for everybody else and taking care of everybody else's needs all the time. And the way I'm sort of laying this out, we think sometimes the ideal is to always be an owl, always be assertive, always be open to, listening to other people's point of view and dealing with conflicts in that way. It is an ideal, but it's not always the best ideal. Sometimes it's productive, effective to be a turtle. Sometimes it's effective to be a teddy bear. Sometimes it's effective to become a shark and to say, you know what I want does matter, and what I'm standing for matters a lot, and I'm willing to even die for it or kill you for it. I'm going to stand my ground on this particular thing.
Not at the hospital though. Not gonna kill anybody, huh? Yeah.
And sometimes we effectively become a turtle. Can anybody think of a time where it might be effective as a strategy to suck it up, pull it in, and maybe pout a little bit, but don't act like anything other than a turtle? Is there a time when you can think that might be an effective strategy?
With some aggressive patients in the ER, sometimes you have to.
Okay, dodge them, stay out of their way, okay? It might also be in a power situation, a legitimate power situation in your work environment. You've got somebody who's lording over you as administrative or organizational chart power over you, and it isn't worth, dying on your sword over. You suck it up, you go home and you bitch to somebody else. but you hold it in right here because sometimes it's not effective to go head to head with somebody else who has legitimate power. So it's like you play the game. It's like, all right, the boss is always right, even though the boss is not always right. It's just something that sometimes you have to do. And in that situation, when you're making that kind of a choice, that is an effective strategy for managing conflict at that moment, at that time with that person. The problem is where we really run into real problems is if in every situation with every person, or at least the majority of the time, you always typically go to one of these three corners. If you're always a passive teddy bear, always giving in to other people, always subjecting, becoming subordinate to others and allowing them to have their needs met, that's a problem. If you always become a turtle, always pulling back, always sulking, feeling like a victim, feeling like other people are always getting in their way, you're pouting about it, you're feeling down and discouraged about everything, that's a problem. And of course, if you're always this aggressive, in your face kind of a shark, then that's a problem. So a healthy strategy, a person who can respond healthily is somebody who can choose a strategy that's appropriate for the situation and doesn't just go to one corner all of the time. Is that making sense? So again, we can paint the picture that this is always the best way, but sometimes being an owl isn't always the best way. Sometimes there's other things you need to do, and sometimes you just do not care about the relationship. But what you want to be careful of is, and it seems the oddest thing in the world to me is, that the people we are most comfortable with, I'd say specifically in your homes, are the people you can act the most ignorant with. You become the dumbest in those environments, and in a professional setting you might act more mature, but as you get to know people, you act different sometimes. And what you're always communicating here on this, according to this dual concern level, is you're always communicating how important the relationship is, and you're always communicating how important your personal goals or objectives are. And if you're conscious of that, you might start communicating things a little differently. So any questions or ideas here so far as I've got this all right? So I know all of you are thinking, you might actually be thinking, instead of yourself, you might be thinking about, oh, I know how he acts now. I know why he's doing that. He's communicating this, or she is. And hopefully you're seeing yourself on here, and you're seeing, this is where I go. Or with this particular person, I always go here. But with this other person, I always go there. And then we want to say, well, what is the strategy? Why are we using a particular strategy with one person, but not with another? And what's going on? And so you can see on the second page of the handout a little description of each of those strategies, and then we've got this map that I just laid out here on the dual concerns. Now the two most difficult characters on here to deal with in a conflict situation are the turtle and the shark. And I could put the teddy bear down on this and say, well, how should you talk to a teddy bear in a conflict? But you don't have to have a strategy to talk to a teddy bear in a conflict, because teddy bears are easy. You get your way with them because they give in to you, and they give in generally happily, and so you don't have a problem with that. We should have a problem with that. If you've got a spouse or a child or a close friend who's always a teddy bear, that would be somebody you might want to help, but they're not a difficult person to deal with. But here in the work environment, be it patients coming in, their relatives coming in, or coworkers, the difficult people to deal with are going to be your sharks and your turtles. And basically, in both of these cases, we can see one thing that they're communicating is I don't really care about you. I don't really care about the relationship. And then along here, one of them is more interested in just themselves, and the other one's not interested in anything, and drops into this more passive-aggressive stance. So, what is motivating a turtle? Why would a turtle hold their head in their shell, suck it up, not make eye contact, put their head down, withdraw, pout? Why would somebody do that?
Like low self-esteem.
Low self-esteem could be one. So if this person has a general sense of low self-esteem, they don't value their own worth very much, they don't esteem themselves very well, then when things aren't going their way, they may, with lots of people in lots of situations, withdraw like that. So that would be one case. What would another case be with a turtle? Low self-esteem would be one.
Abuse?
You want to explain?
Like somebody who's been abused?
Somebody's been abused. They've been basically coached, taught to, conflict comes up, hunker down, hold down. Okay? Other things? How about, all of us have been there before, all of us have dropped into turtle land before. We've changed our position to everything's great, to everything sucks, you know? So what's going on in our minds when we pull into that corner? What's happening when we go there? How do we feel in our bodies here?
You just start wanting to do anything to get out of that situation and want to go home and cry about it later. I'm not sure a way to do it,
Okay,
is to just go into the flow.
because
You're depressed.
you're depressed,
You're
You don't want to deal
overwhelmed.
with the conflict at all.
don't want to do the conflict, and could it seem like it doesn't matter what I say or do anyway, it's
Pointless.
not going to matter? It's not going to change anything, so why stick my head out there? It's just going to get bitten. You know who loves turtles the most? Sharks. Sharks love turtles. You know, they're waiting for that head to pop out of the shell and come back at them again. And so if you're up against a shark, that can be very difficult and can be very scary, disempowering. If you've got a sense of low self-esteem already,
Owls like teddy bears.
or in this situation you feel powerless to make a difference, no matter what I say or do, it's not going to matter, then that's what's going to cause you to feel withdrawn and pulled in. And okay. Other ideas on that?
Does that mean owls like teddy bears?
No, does that mean that in this model, owls sort of like everybody. Owls sort of think, you know what, if we talk through this, we'll be able to work it out. The problem is, how well can I work it out with somebody who's down in this corner? How well can I work it out with somebody who's down in this corner especially? These are, no matter how assertive, how open, how nice you are, you cannot help somebody very well when they've changed their present interpersonal position to one of these ineffective corners. So one of the counsels I'll give to parents, and you know, all we are here is just big kids, right? I mean, we hardly even feel like we're adults sometimes. I know that. I'm 52 and I still don't know what the crap I'm doing in this life as an adult. You know, I was like, yeah, figure this out. But one thing I tell parents all the time is, if you've got a child, you know, that's running off in the corner, running off to the bathroom, locking themselves in the closet, whatever, pouting, don't reinforce that. Don't allow that to go on. Because that 4-year-old is going to be 12 years old pretty soon, and then they're going to be 16 years old, and they're going to be 24 years old, and they're going to be 34 years old. And if that strategy seems to be the working strategy for dealing with things all the time, you're basically reinforcing running into this corner and pouting. And so go find them, talk to them, see if you can get them back up, get them back breathing, get them back moving, and get them back affirming themselves and their worth, because that can be a strategy that's really hard to break after you've practiced it and practiced it and practiced it. So one thing we're saying here is a turtle, maybe from past experiences with abuse, maybe a low self-esteem, or they're powerless in a situation. You know, those are some of the things that's driving turtle behavior. What do we think is driving shark behavior? What's going on with a shark?
They like to be controlled, they like the power play with them.
And what was the first word you said? They don't like to be controlled? Was that the first phrase?
They don't like to be controlled, they want to be in control.
Right. Yeah. And any fear of somebody else controlling them, dominating them, their strategy for dealing with that is to come off aggressive, loud, in your face. Okay? Other things that would motivate a shark.
I think the same thing as a turtle.
Okay? In what way?
Well, like if you've been abused, then you might turn into an aggressor instead, you know, get them before they get you, or
Yeah? Yeah. Yeah, and if you go back to the abuse idea that you said there earlier too, it could be some of the same kind of things that start that off and one just practices or strategizes coming here more often than one over here. Sometimes I've talked to a lot of turtles who feel like they are sharks because of this aggressive part that comes out, but they're really not sharks, they're really turtles. They just really feel powerless, and they try to regain that control sometimes by coming out aggressive, but they pretty much are, the underlying driving force there is, I don't feel like it matters what I say or do, it's not going to make a difference anyway. Okay, so does this model seem to, is this a good framework for thinking about people in conflict situations? And I like the animals. This is something you'll always remember. It's easy to remember instead of using psychobabble on here. We can use animals and you keep that down. It's also something easy to teach to children because they can get it, they can relate to the characters. I've even got some puppets kind of a thing, sharks, turtle, teddy bear, kind of a things that sort of help people relate to this sometimes better. So the question now is, if somebody is, well, let's just say this. If you have changed your present interpersonal position to down into one of these corners, that is not the place to try to solve a problem. If you find yourself in one of those corners, that's not the time to try to problem solve with another person. You're not in the right frame of mind to be dealing with a problem in an effective kind of a way. And the problem too is when we change our position like that, when we're under a lot of stress, we have a sense of urgency that we need to fix this problem now. And usually when we're under stress and we have this sense of urgency, that's the worst time to try to fix a problem. So if you have traveled down into one of these corners, it may be good, like what she suggested earlier, if you're in a situation and you're powerless, it's better just to go home and cry about it somewhere else. But don't try to take it out on that patient or take it out on that coworker. You're not in the right frame of mind right then to do that. And so the first thing you need to do to get into problem solving mode is you've got to get yourself centered again. You've got to get yourself in a position where you're counting your worth and counting the other person's worth and counting your own goals and needs and the quality of the relationship and how important it is to you. And then you're able to communicate to try to solve that problem. If another person has gone there, and let's just say that you're centered, you're okay, you're up here as an owl, then what are you going to do to get this turtle to travel back up here and count their self, count their value, recognize their goals, recognize the quality of the relationship or the importance of the relationship? How do we talk to a turtle? Now, I know some of you have already looked at the handout. So I remember one time working with a couple it's like 20 years ago, and the wife, we just barely started talking about something. All of a sudden, she shuts down. And the husband's like, what do I do? She's curled up on the other chair and won't make eye contact. I'm like, oh, geez, what do I do?
You pushed the button.
How effective are we going to be today? This is not going to work very well. So, when you've got somebody in turtle land, they physically have changed states. And you'd like to get them to change out of that physical state. So I asked her if she'd just take a risk with me. And she agreed that she would. And I said, I'd like you to just stand up right here if you would. And she's just sort of, she's in this ball kind of a thing. And we didn't really even know what had happened right there, what had been said, but she has completely withdrawn. And so, standing up was so hard just to get her to stand up. So she stands up. And then I ask her to stretch her arms up, ask her to breathe. And I'm just trying to break her state, break that physical state, get out of that mode and start moving around. Start moving around and start breathing. She doesn't have to start talking right now, but breaking that physical state. One time, again, 20 years ago, working at the high school, I go into my office one day, And there's this kid sitting curled up on the chair, both of his legs up, big old snot balls running out of his nose, and he's just sobbing. And this secretary, Mary Romine, had brought him back there to my office, and she didn't know what had happened. And I didn't, I walk in, there's this kid, and he's just closed off. So I said, I don't want you to say anything to me. I just want you to do one thing, if you will. Let's get up, and let's go outside, and let's walk around the building, outside the building. And so we got up, and just to get out of that ball right there was the hard thing for him. Go outside, and let's walk. And as we're walking, and as the air clears and his mind starts to clear, we can talk about the problem he was having. But I had to get him to physically break the state first. So if you've got somebody that's all locked up like that, if you can distract them into doing some other activity right there, go do something else physically, they're more likely to be able to break that state. And that starts the path right there to getting themselves back center again, back counting self and others and how important their goals and objectives are. So you can't force somebody to do that. So let's just say that you wanted to talk to somebody, that they resisted that, and they're not going to go there. So then you don't want to turn into a shark and force them to do something. So what you're going to try to do then is you're going to try to do what's called contracting with them. I can see that you're upset right now. I can see that you're discouraged. What I'd like to do is I'm going to go away for 15 minutes or 30 minutes or whatever it is, and I'd like to come back and talk to you later. But I'm going to give you your space right now. I don't want to make you feel more upset right now. And you're basically contracting with them that I'm going to come back and touch base with you again, and you're giving them space. Now, if you're feeling a little sharky right now, you're not going to do that. You're going to feel like, get your head out here right now and talk to me, and you're going to have this attitude. And what's that going to do? These two are both interested in power. Which one, if you're dealing with a shark or a turtle, which one really has more power?
The turtle.
Turtles. Turtles have a lot of power. I am a turtle sometimes, but not very often. But a turtle will piss me off because they have a lot of power, and they pull that. It's a way of really controlling the situation. A shark's trying to control the situation too, but this is a lot of control from a turtle's perspective. So you're kind of trying to break the state, or you're trying to, and if you're saying, okay, I'll come back to you, I'll talk to you another time, then you're giving them some space, but you still need to come back, and you say, hey, what's going on? Even if they say nothing, they're talking a lot. You're starting to score points right there. Talking is important. But if they don't talk, they stay locked up, they stay shut down, and you got to, as genuinely and honestly and sincerely as you can, all of those words don't match a shark. You got to check your attitude. If you're coming in here like a shark, it's not going to be helpful. If you're not balanced up here yourself, it's not going to be helpful. But if you genuinely say, I think I understand what's going on with you. My guess is that you feel powerless right now, or you feel hurt right now, or this situation that occurred over here caused you to feel this way. And now what you're doing is you're speaking for them. You're putting words into their mouth, you're speaking for them, and if you get the head nod or you get the eye contact, that head nod and eye contact and body movement is pulling out of there. Now I'm giving an extreme example of somebody shut down. Not everybody shuts down that extreme, but it's the same thing if you're just dealing with a coworker who now's like, I'm not talking to you. It's like, okay, are we all going to dance around the eggshells here today, or are we going to talk about something? So how are you going to deal with that person? And so if they're not making that eye contact, you can then make a guess. Here's what I think might be going on with you. Am I right? If you're sincerely trying to talk about what the other one's thinking and feeling, then they will feel affirmed, and they're more likely to start to coming out of that shell. I saw a smile right here. I don't know if you're reflecting back on an experience with somebody or thought about something or.
No,
No?
I just burped.
Oh, there we go. So as I'm strategizing on dealing with a turtle, and you're thinking about this situation, be it a child, family member, coworker, partner, client that has come in, patient that's come in, has anybody got a story or an example of dealing with a turtle, or maybe you've been a turtle yourself, and what helped keep yourself or that other person to start coming out of there, like what I'm talking about here?
If I had kind of an example similar to yours when I was a school nurse. One of the teachers brought a kid to me that had been pretty much curled up in the fetal position on the floor, wondering if I could do anything. And so I could tell that he probably needed some exercise. So I asked him if he thought he could run a mile up on the track. And of course, he said, "You think you can beat me?" And by the time I beat him by maybe 3 or 4 feet, he was talking, and so it was interesting to
The physical state. Now, did you think maybe you had a strategy to do that in the back of your mind, or did that just sort of come as a natural?
This has been probably 7 or 8 years ago, and I don't remember why I did that,
Right.
but it was kind of fun, and it worked.
Okay.
Yeah.
Okay. Okay. Any other examples there? Or an example when you felt sort of shut down and powerless, and somebody helped bring you out of that corner. Have you had? Yeah.
Well, if somebody like kind of makes a joke or something, I know in certain situations that's not good, but that helps me sometimes. People keep it light or, understand that it's
Okay.
not, this isn't going to be like this forever.
Yeah. As long as it's not a joke about you.
Right,
Making
right.
fun of you.
Yeah.
Yeah. Okay. Sort of try to change subject. Don't make it so heavy, and lighten things up. Lighten up the mood. Okay, that'd be good.
I think one patient that did want to cause harm to themselves, and we did have them within the hospital here for a time frame, and I remember, I don't know whether or not it was handled right, but we had 2 nurses in the room, one that was visiting with the other individual in the room, and then myself visiting with the patient, and I just got down at eye level and just had a conversation, and just soft talking and short conversation. It seemed like opened up a little bit, but it took time.
Yeah.
And it wasn't just everything happened on my shift.
Yeah.
And I don't know how it all turned out in the end.
But you saw just a little crack there starting to come out, and you weren't forcing, you weren't being derogatory, you weren't, if it comes across like you've got a manipulative strategy for getting turtles out of their shell, well, they're going to read that pretty well, and that's going to backfire. But if you're genuine and sound genuine and really concerned, more likely to help pull them out.
Sometimes with patients, I've found if you just say, "What can I do for you?" "How can I help you?" It just helps them open up, and a lot of times they'll, well, it's not you, and then they start telling you what's really bothering them.
There you go. Yeah. Just that, and so that genuineness of what can I do for you, if they'll buy that that's sincere, then they're likely to do, it's that talking, breathing, moving, interacting, that just automatically starts to get them out of that shell, where we now have more of a higher likelihood that we're going to deal with something effectively. Okay? Okay. Now let's shift over here to the shark. So the first thing with the shark is keep yourself safe. Sharks can hurt you. And it doesn't matter that you're here in a professional setting with coworkers or patients coming in or their family members. If you've got an aggressive, sharky kind of person, they may physically harm you. They may, so you always want to keep a safe distance And the most, so we talked about, so what's going on with shark, we talked about powerlessness here, same kind of thing here, powerlessness. The shark overcompensates for the power by trying to be the most powerful, so they're not going to get manipulated or used in a situation. And even with the shark, your basic strategy with them is that you are trying to find something that you can agree with from their perspective. And you, again, have to be genuine. And basically what you're saying to that person is, if I saw things the way you see them, I'd feel the same way you do. And that's true. If you did see things the way they see them, you would feel the same way they do. You may not see it that way, but that's what you're trying to communicate. What a shark expects people to do is they expect people to become sharky back to them, or they expect them to withdraw and give in to what they want. And that's their strategy. That's how they get their way all the time. And so if you will address them by agreeing with them in some way, instead of clashing with them, just adding more fuel to the fire, if you find something that you can agree with from their perspective, then they're likely to then start to de-escalate in their aggressive stance. And so, I had a person here in the valley, again 20 years ago, use that example, where I did an assessment on the person's son that committed some sex offenses, and my recommendation was, needs to be out of the home. Needs to go somewhere else for a treatment program because he's no longer safe. Others aren't safe in the home, others aren't safe in the community, has to be in a different setting. And the dad came in, and I was the only one in my office at that time, which was at that time just right here across the street. And the dad came in, I'm the only one there, and I'm behind the reception window, and he's on the other side, so we got this barrier between us, and he's like lit up, you know, you're taking my son away from me, all these things. So this might not have been the smartest thing, but it seemed to me like that barrier between us was giving him more
Power.
license to be aggressive. So I asked him if he would sit down in the waiting room, and then I want to come out and talk to him. And so I had him sit on one side, and I sat on the other side, and then all I did was I tried to find something that I could agree with. Yes, this must be difficult. Yes, I understand how hard this is. Yes, I understand your concerns. And as I'm finding everything that I can to agree with and affirm his position and his perspective, then he chilled down. He may not have completely liked the overall situation and what had to happen, but as he chilled down, we could talk like two human beings instead of, you know, two sharks talking with each other, and I could de-escalate the situation that way. If you can't de-escalate the situation verbally with somebody, then with a shark, just get out of the situation. Don't put yourself in a place where it's going to continue to escalate. And here on your grounds, you don't have security on ground. So you may need to call the sheriff's department. You may need to call Dave. Dave will come in, he's security. He can outrun a teenager, he just told you that. So he can probably handle this too. No, we don't want to get anybody hurt, so if you can't get a shark to de-escalate, then that's the thing that you do. And let me see if there's any other strategy here on the shark. So the overall strategy with the shark, the wording that I've used there to describe it, is using what's called an Aikido principle. And the idea is that you blend with their aggression and you turn their energy and redirect it, basically. But you want to, instead of doing this with the shark, you want to bring it on. And that's where your first thing is agree with them. Agree with them. Don't counter them. Don't agree with everything. But find something that they have to say that you can agree with and affirm that. And that's something they don't expect. They expect you to become defensive. That's how they provoke everybody. And so you agree with them, you talk them, you get them to start chill down right there, and then we can get into an effective, more productive communication. Anybody got any stories here of dealing with a shark and how you de-escalated a shark?
I work on the ambulance as well, and we get some interesting characters.
Drunk mostly?
Huh?
Drunk?
Yes,
Okay.
some kind of intoxication generally.
Yeah.
And they want to argue with, why do I have to have backboard? Why do I have to have an apparatus get me off? And they're very aggressive. And I had one that was very adamant, and I said, I know it's uncomfortable. I know that this is bothering you, and I understand that, but in order for me to effectively help you and to keep you from getting more injured, we have to do this.
Right.
And for a split second, he stopped and went, okay, that kind of makes sense.
Yeah,
But I don't like it. I understand you don't like it,
yeah. Coming right back that I would agree.
but I don't like it. It bugs me. I realize that. How about if I put some padding here? Does that help it? So I just kind of walked through that, and he was still aggressive and verbal and all the way in,
But manageable.
and continued in the ER.
Uh-huh.
But at the same time, it was just a matter of, yes, I know that this hurts, but you have this big gash on your head. You were in a car accident. You told me you were drinking. I can smell it. We have to be able to make sure that you're really okay.
Right.
And it just a matter of, it was always that constant little window. There was that little window of, I understand,
Yeah,
but then back to the irrational again, and we just had to keep revisiting that window of understanding.
yeah. That's a
Redirect-
great
a lot of
example.
redirecting.
Yeah. Yeah,
Sometimes that 10-minute ambulance ride feels like an hour.
well, I grew up with a drunk, you know, so the strategy was, is Dad gonna be a happy drunk today or a mean drunk today? And but you have to figure out how to do the dance, and you might just have to keep dancing all the time. Yeah. Other examples of dealing with aggressive, sharky kind of people. So the strategy makes sense. Find something you can agree with. Agree. Even as she's explaining that story, every time we heard her say the agreeable kind of thing, you could feel how that could de-escalate any kind of a situation. So that's your primary thing with the shark. Find something. They don't expect it. They expect a clash with a clash. They expect people to withdraw. Stand your ground. Find something you can agree with and stick with it. And you can always find something. Even if you can just say, if I saw things the way you see things, I'd feel the same way you do. Even if you can't find some specific thing about all of that, that alone, if you can genuinely communicate that, it's going to connect with them in a way that goes, what? You know, I'm not expecting that. I'm expecting somebody to come back at me with resistance, and you're finding agreement, and that's the de-escalation point right there. So, and time-wise, we're almost done. Any other thoughts here? Now, I'm going to come back. I can't come back next month because I've got a thing in Florida. I've not been to Florida before, so I'm not going to say, well, I've got something to do at Star Valley Medical Center for an hour. And then I'll come in the next month, and it's pretty much, open. What do you guys think? If I were to come in and make a presentation on something, is there something here that you guys say, hey, we'd like to hear something about something that would help us be more effective on the job or be more effective with clients that might be coming from a psychology perspective or whatever? Anybody got some feedback or input on that? How to ask for a raise?
That'd be good. I think suicide is probably the one that, and sometimes those kids are just so down, and just kind of how to help them, I guess.
Okay. So we can deal with, so we sort of did that the last time when I had Shane Johnson come in. We talked about the Title 25 process.
Right. I don't mean that part. I mean the actual dealing with the patient.
Okay. Yeah, so let me.
Which is kind of what you've done some of that today already.
Yeah, so we can talk about sort of an acute moment, like here they are in the building trying to deal with them. I could talk about it okay, what could we do to help them if you refer them over to us for therapy with somebody who displays this kind of behavior? And I can tell you what the model is for doing dialectical behavior therapy with suicidal risk clients. Would that be interesting? It's not so much of in the acute moment. It could entail that because that's sometimes what a therapist needs to do when somebody's feeling way down. But when they're feeling way down, we're about as handicapped as you guys are. Let's get them over to the hospital, get them evaluated, and put them on hold until we can get them stable again. But really, it's the long-term care that we're trying to treat them with that maybe if you could see what that strategy is.
For the long-term part of it.
Like if you
Because
make it,
I really don't understand what you do with people.
okay? So
I
that's,
don't know, maybe somebody else has something different, but
yeah. So that's a feedback from Trish. Others thinking that'd be a good idea too, or have you got another thing to consider?
I would also feel like I could personally benefit from like how to deal with battered women, like how to like to be supportive, but like to like help them as much as I can. Cause I know like we deal with it a lot where, and it's just kind of like you don't know what to say, you don't know what to do, like you don't want them to be in that situation, but you don't feel like you can tell them anything, you know,
Yeah.
and cause you know.
Yeah, I'll tell you one thing on that topic. We go to Idaho across the border, we go to Utah, we go to Colorado. We go around us and we have special treatment programs for domestic violence situations, and Wyoming has hardly anything. No standards, no effective, no standards for what an assessment should entail, very low referrals from the law enforcement into the courts, and the courts into domestic violence treatment programs. And, you know, we had a number of years ago, the Mothers Against Drunk Driving that rose up and said, these DUI problems and these blood alcohol content levels are unacceptable, and we need to do something to get people assessed and treated. For whatever reason here in Wyoming, we don't have enough people who have risen up yet in a social action kind of a movement and said, we have got to do something about this. Everybody else is doing something. And law enforcement, what they tell me is many, if not most of their calls are domestic calls, but they don't do anything legally about it because nothing's going to happen if they did anything legally about it. So it just stops right there, and people, the problem continues to be perpetuated. So yeah, that's a big deal. Other topics. I'm gonna roll with something that's probably because I'm comfortable with it. I'm gonna roll with Trish, but I'm gonna take more like, here's what would happen if you knew somebody that you cared about that's at risk of self-harm or harming others, or that kind of a clientele. And here's what you could expect if they were referred into a program like what I have to offer, and sort of the thinking that goes behind that. Does that sound good? I'll give you my house model. I'll give you my mindfulness, dialectical behavior strategies, basically, that we look at for working with that kind of clientele. So, okay, well, I'll erase the board and we'll turn the time over to your pharmacist.
Thank you, Kipp.
Thank you.
All right, point order.
Dave, he doesn't have a T-Rex on his little,
What was that?
he doesn't have a T-Rex on his
You guys want some pizza?
little graph there.
I know. That's the best mental health you can possibly have. Somebody in
You should
a
think about that.